For years, the discussion on the safety and legalization of medical marijuana use nationwide has been a popular topic of debate. Described by numerous doctors as a safe and effective medication, marijuana not only has relieved millions of people of pain, but has also produced hundreds of millions of dollars in taxes. But in many states today, marijuana is highly illegal, and someone found to be using or trafficking the drug can face major jail time. I want to address the members of the U.S. Congress, and more specifically the House Judiciary Committee, as they can have a major impact on the laws that restrict the use of medical marijuana and the consequences it holds. If the laws and stigma surrounding medical marijuana were to change in a pro-marijuana way, millions of people in the U.S. who suffer from chronic pain and other illnesses could have the access to the treatments they need. Marijuana has been used for medicinal purposes for hundreds of years, dating back to 2900 BC, when Chinese Emperor Fu Xi referenced marijuana multiple times as a medicine, and then later by Chinese Emperor Shen Nung when he described marijuana as having healing properties. And to this day, millions of people use marijuana for medicinal uses such as reducing pain, nausea, and inflammation. There are over 400 chemicals in marijuana, 80 of which are unique to the drug, called cannabinoids. The most active being THC, which is mainly responsible for the drug's ability to reduce nausea and vomiting. And although the FDA has not approved the marijuana plant as a medicine, they have approved a synthetic version of THC. But the problem with the synthetic version is that it can have various side effects, including patients who have schizophrenia having adverse effects after taking the drug. The FDA has said they haven't approved herbal marijuana as a medicine because it hasn't been proven safe and is effective in no way towards treating illnesses, despite numerous studies showing otherwise. And the DEA has marijuana listed as a Schedule I drug, meaning it has a high chance for abuse and has no accepted medical purposes. But a study done in 2007 by the U.S. National Institutes of Health showed that only about 9% of people who try marijuana will become dependent on it, compared to alcohol, which is at 15%, and tobacco, which is at 31%, both of which are legal. Currently, there is a bill known as the Rohrabacher-Farr Amendment, which prohibits the use of funds from certain states to prevent any of them from making their own laws that would authorize the use, distribution, possessions, or cultivation of medical marijuana. Although this bill doesn't make medical marijuana legal everywhere, it makes sure that the people living in the states where it is legal can't face consequences for using it. But recently, there was some concern about whether or not Congress would renew the bill in the spending budget, which would allow the DA to begin cracking down on medical marijuana and its consequences again. And because of this concern, and because there are new members of Congress coming in who may or may not support medical marijuana use, I want to propose not only to the members of the U.S. Congress to continue to renew the bill long term, but also to the House Judiciary Committee to help achieve nationwide legalization by passing bills regarding the reformation of marijuana laws. And because of the numerous studies that have been done on medical marijuana showing that it is a safe and effective medicine, I would also like to propose to the FDA to reconsider studying marijuana more in depth, as the well-being of millions of Americans is at stake. Legalizing and taxing medical marijuana would have a very positive financial effect on America. In 2013 alone, 7 different states had a combined tax revenue from medical marijuana of over $120 million, and since then each state has earned hundreds of thousands of dollars a year, which can be used to improve schools, roads, and other public buildings and programs. And by adding shops and farms nationwide, thousands of jobs are being created, which is also very helpful to the economy. But before the states and government start making their money back from medical marijuana, there will have to be money spent in order to implement the shops and dispensaries. In North Dakota alone, it could cost up to $10 million for the 2017 to 2019 biennium to cover the cost for full-time employees and many other fees, including federal inspection. The U.S. has already come a long way in that 28 states, plus Washington, D.C., have already legalized medical marijuana, and lawmakers in multiple states are doing what they can to legalize the drug, or at least reduce the consequences marijuana holds. There are also many interest groups that are working hard to have marijuana decriminalized and legalized, including NORML, which is a group that has been trying to reform marijuana laws since 1970. They were successful in the 1970s at helping decriminalize minor offenses of marijuana and lower the penalties for many states. They are still active to this day and helping people find ways to access the treatment they need and are working hard towards having medical marijuana legalized nationwide. Many politicians have started to shift their views on marijuana from a dangerous drug to realizing its medicinal purposes. In the recent election, popular Democratic candidate Bernie Sanders was very supportive of the legalization and decriminalization of marijuana, and even President Trump stated in February of 2016 that he is in favor of medical marijuana 100%. And it's not only these two who have voiced their support for medical marijuana, but also many other candidates in the recent election, including Rand Paul, Jill Stein, Gary Johnson, and Hillary Clinton. But apart from the opinion of many politicians, there have been multiple opinion polls on the legalization of medical marijuana, including one done by Harris Poll in 2015, where 81% of adults said they would be in support of the legalization of marijuana. And the amount of supporters of medical marijuana has grown over the years, which is shown by a poll done by the same Harris Poll in 2011, where only 74% of Americans said they would support it. Although it will take a lot of hard work and waiting to get there, I can see in the near future everyone in the U.S. having access to medical marijuana to help treat their medical needs. From the obvious support around the issue from politicians and the people, to the exponential growth of tax revenue that states are reducing, it won't be long before medical marijuana is accepted nationwide as a legitimate medicine.